everyone. In this session, I am going to discuss regarding writing a research proposal which may be helpful for nursing students. And this is a part 2 video. So for those of you who have not watched part 1 video, I'll put the link in the description box. You can click on to it and you can watch it. Actually, in part 1 video, I have discussed regarding the introductory part of writing a research proposal. So in this video, let us see how to write the research methodology, the work plan, budget, ethical consideration, references, and the appendices. So the first element under research methodology is research approach. So what should be written under research approach? So we know that in nursing mainly we have two types of research approach. One is quantitative research approach and the other one is qualitative research approach. So depending on what study you are taking, you can write whether it is a quantitative approach or a qualitative approach. Then there is a new type of research approach which comes up at present, and that is called as mixed method research. Okay, so mixed method research design, if you're using, you can write the approach as mixed method research approach, which means you are going to use both qualitative and quantitative approach in your study. Now, next on research design. So that is how you write a research approach. Just mention whether it is qualitative or quantitative or a mixed method research. Now, coming on to research design. What should I write under research design? So again, it depends on your research approach. So if you are selecting a quantitative research approach, your design might either be experimental design or a non-experimental design. What do you mean by an experimental and a non-experimental design? If you're going to use an intervention, then it becomes an experimental design. And if you're not going to use any intervention, then it becomes a non-experimental design. So you will have to write quantitative approach means the research design. If you're using an intervention, please write it as experimental, or otherwise you write it as non-experimental research design. Please don't stop with that. Under experimental research design, you will have to specify which type of research design. That is, under experimental, we have true experimental, quasi-experimental. Now, under true experimental, again, you have two group pretest post-test control group design. You have crossover design, Solomon's 4 group design. So many designs are there. So again, you will have to very clearly specify research design, experimental design. So what is it like hyphen? It is a, or you can write it as true experimental research design. Maybe you can put a colon and you can write what is the name of the design. Say, for example, two group a pre-test, post-test, control group design. Okay, so you can write like that. Suppose if you're using quasi-experimental also, you can write quasi-experimental. Under quasi-experimental, you have many different types. Okay, so you will have to specify that and write while you're writing the research design. Same thing for non-experimental. Okay, non-experimental, when you're writing, again you will have to specify and write whether it is a descriptive research design or whether it is a correlational research design. So many types are there. So what is the final word? Whichever design you are writing, specify that and write. Same thing holds true for qualitative research design. In qualitative research, there are many designs are there. Okay, so maybe if you are selecting phenomenology or grounded theory or ethnography, that should be specified under research design. So we have completed research approach, research design. Next is setting. What is setting? The place where you are going to conduct your study is called as setting. Okay, so the researcher should have an idea where exactly you're going to conduct the study. So you will have to write that in the research proposal. Maybe the name of a particular hospital or a name of a particular college or a community. Wherever you're going to do, that should be specified. Whenever you specify the name of a particular setting, please be careful to ask permission from that setting. Okay, like at least a verbal permission. And when you're doing a research proposal, it may not be possible to get a written permission. Okay, so in that case, at least a verbal permission. Just inform them and try to get their verbal permission that you're going to do a study in that particular setting. Okay, otherwise what will happen is, if you're not going to ask and at the last if you're going to stand and suppose if they're saying no, it is going to be difficult for a researcher during that last phase. So it is better to inquire and find out about the permission of the setting, at least a verbal permission. So permission all you need not write in the research proposal. Please just write where exactly you're going to do. Okay, the research study will be conducted in that specific name of the college or name of the school, wherever. Okay, you can write that and write a brief statement on it. What is a brief statement? At least when you're doing a research proposal presentation, you should present a brief statement. What is a brief statement? To say, for example, I am going to do a study in a particular ward, say B ward. Okay, I am doing the study in B ward of a particular medical department. I am doing it in B ward of, say, the Department of Medicine. That is the setting where I am planning to do. So, say, for example, I am going to do it among nurses. Okay, so now what I'll have to write is, the study will be conducted, say, in the Department of Medicine. Say, if I'm so thorough, I can write B ward and then write briefly write about it, like how many nurses are there in the hospital, or how many total number of nurses are working in B ward, how many beds are there. So that will give an idea regarding the setting to the experts who are listening to your research proposal. Okay, so it's nice to specify with one statement at least, to specify and tell that about the setting. But while you're submitting your research proposal, if your word limit is really very less, and if you're not able to explain about that, forget it, no problem, but write the setting, specify the setting. Next is on population and sampling. There are a lot of things we should know about population and sampling. What is a population? We know there are two types of population: target population and accessible population. What is population? The total entity of that particular sample is called as the population. What is a target? What is an accessible? We all know. Suppose if I am going to do a study on fatigue among patients undergoing dialysis, like who is going to be the population? All patients undergoing twice weekly hemodialysis. If I'm going to take only twice weekly dialysis, I will write all patients who are undergoing twice weekly hemodialysis will be the target population. What is a target population? To whom the study results can be generalized. Okay, I am doing it in a sample, but the study results can be generalized to a larger group. That is called as a population. So all patients who are undergoing twice weekly dialysis becomes a population. But what is an accessible population? Accessible population is the number of people who are undergoing dialysis, say in a selected hospital. That becomes an accessible, wherever I'm going to do. That is an accessible population. What is a sample? From that accessible population, says 200 patients are there undergoing dialysis. From that I select 50. That becomes the sample. Okay. Now, when you are writing a research proposal, you will have to specify who is your population, who is your sample. Okay. Maybe if you don't have word limits to write about target, at least write about accessible population. Who are the people who are accessible population? Who comes under accessible population, and who is your sample? Sample may be, say, 50 patients who are undergoing hemodialysis in a selected hospital. That is going to be the sample. What else should I write? Regarding the sample, you should write about the sampling technique. What is sampling technique? We know there are two types of sampling technique: random sampling and non-random sampling. So which sampling technique are you planning for your study? Okay. Now, like certain sampling techniques are mandatory for certain types of design. For example, if you are going to select a true experimental research design, then definitely you should do a random sampling. Randomization should be there. Okay, that is something mandatory. So please check with your research design. Certain sampling suits well for certain designs. So read on that and then write a sampling technique. If you're going to do a descriptive study design, say I want to select 300 people or 200 people, then maybe it is not possible to go for a random sampling. In that also you can do random sampling. But suppose if the number of participants is very less, okay, then maybe I can go for a consecutive sampling or for a convenience sampling. If you're going for a qualitative research, maybe you can go for a purposive sampling. Okay, so it depends. See, for each and everything, there is no, correct, right, or wrong answer in sampling technique. Okay, you will have to think about the availability of samples. How many are there? Can I do a random sampling? Will there be sufficient sample to undertake this random sampling method? Okay, is it better to do a convenience sampling or a consecutive sampling? Think over it. Okay, and when somebody asks you a question, why did you go for a consecutive sampling? You should have an answer why you selected consecutive and why you did not go for a convenience sampling. Okay, so think over it, take time, and then try to justify why you have selected a particular sampling. So when you write a research proposal, you have to write what is the sampling technique. Next is you will have to write about the sample size. Especially for quantitative research, you have to write the sample size. For a qualitative research, maybe we say that it is based on data saturation. Whereas for a quantitative research, you have to estimate. How do you estimate? You know the answer. Estimating is the sample size is by using power analysis. So how to do this power analysis? Based on previous research studies, or if you are going to do a doctoral level studies, it is based on your pilot study also. Okay, there are a lot of problems when you take pilot study findings, but still cautiously you can use your pilot study sample in order to estimate the sample size. Okay, so you will have to consult with your statistician and then use a particular formula, and then you are going to derive at the estimated sample size. So that formula you have to write in the research proposal, which study, based on which study that particular sample size was estimated, that point should be there, and what is the total sample size. Okay, that based on that formula you will have to write in the research proposal, so that it is very transparent. Okay, it is very transparent that it is only based on this formula estimation I have come to a decision of this particular sample size. So please write that sample size. Okay, and one more thing which I would like to add is, whenever you estimate a sample size, okay, think about the attrition that is possible in your study subjects. What is attrition? Losing subjects. When do I lose subjects? Like for example, if I'm going to do among dialysis patients, and suppose if I'm going to do it as a longitudinal study, say I want to do a post-test assessment 1 month after the intervention, 3 months after the intervention, 6 months after the intervention. So this may be more applicable for a PhD level study. When you're doing like that, there is a chance that I may lose my sample. Okay, because attrition is there among dialysis patients. Like some people die during dialysis. Okay, and some people they become very sick and they are getting admitted in intensive care unit. So maybe there is a chance. So consider that practical percentage of attrition which is there, and try to add on that to the sample size which you have calculated, so that you are not going to be affected. So please add that percentage of attrition. Say for example, I got 45 in my sample size estimation. Maybe I'll take around 50. 10 percentage attrition I consider, and I take it as 50 will be the sample size. So think about it, work with your statistician and write that sample size. The next thing what you have to write is sampling criteria. What is sampling criteria? Which sample I will take, which sample I will not take. That is called a sampling criteria. So as you all know, we have two types of sampling criteria: inclusion criteria and the exclusion criteria. Inclusion means who all will be added, right? So who all will be. Now one point which I want to make it very clear in sampling criteria is, some students when they write the inclusion and the exclusion, they just write it as opposite. Like for example, inclusion criteria, they will write patients who can read and speak and say understand English or Malayalam. Okay, but when they are going to write the exclusion criteria, they will write patients who cannot read, understand. So it should not be like that. Okay, you should not write just the opposite of what you have written in inclusion criteria, should not be written in an exclusion criteria. You should try to find out some other points where you're going to exclude such participants. Now for example, now let me talk about the study on fatigue, okay, in patients undergoing dialysis. Say inclusion criteria, I may write like patients who are what to say undergoing dialysis, like patients who are undergoing dialysis twice a week. Only twice a week patient I'm going to take. Okay, thrice a week, once a week, all I will not take. So patients who are undergoing dialysis twice a week. Then maybe another one inclusion criteria is maybe like patients who can understand, read and speak, say Tamil, Malayalam, Hindi or English. Okay, so only these languages. Now say for an example, for an exclusion criteria. Now exclusion criteria, what I may write is like patients who are admitted in the intensive care unit. I'm not going to take sick patients for my study. Okay, so patients who are admitted in intensive care unit, I am not going to take. So that is one exclusion criteria. Then maybe like patients with some specific comorbidities, I don't want to take them. So that is how you write the inclusion and the exclusion criteria. Please be careful. Don't write just the opposite of what you have written in inclusion as exclusion criteria. Try to think over, try to read a lot of studies so that you can get a lot of points and you can come to a clear cut idea who will be my sample, who will not be my sample. So that is about population and sampling. So many things you have to write. Okay, mention who is your population, who is your sample, tell us which sampling technique you are planning to take. Is it random, non-random? If it is random, which random sampling technique are you going to take? Is it simple random or stratified or cluster? What is your type? If it is non-random, have you thought about it? Which sampling technique, convenient or total enumerative, that has to be written. Sample size, how did you estimate it? Which is a formula? What is the sample size you got? Okay, so that has to be told. Inclusion criteria and exclusion criteria. So the next thing what you're supposed to write is, as per to the proforma, the tool and the technique. So we all know tool is different from a technique, is it not? What is tool? Tool is an instrument. What is technique? The method I use for collecting the data. Now let us see, when I use a tool, what all should I write about the tool and technique? First thing what you have to write is, you should write the name of the tool. What is the name of the tool? Say for example, in fatigue among patients undergoing dialysis, maybe I will be using two tools. Okay, one instrument will be for measuring the socio-demographic proforma. So tool number one is going to be what? Socio-demographic proforma. Maybe under that I have demographic data and clinical data. Okay. Number two is I am going to use a tool to measure the fatigue level of patients. So I will have to name the tool. So now from where will I get this tool? Okay, you can either select the tool or you can prepare the tool. So that is the second one. Okay, selecting or preparing the tool. What do you mean by selecting the tool? Selecting a standardized tool. So I will look for whether there are any standardized tools which are available. Like for example, Piper is there, revised Piper is there, multi-dimension fatigue inventory scale is there. So many are there. So if I am going to select, so I came to a conclusion, I will use revised Piper fatigue scale for my study. So in that case, I am selecting. If I am going to prepare a tool, then it comes like I will be developing a rating scale in order to measure the fatigue level of patients undergoing dialysis. So tool, you should specify the name. You should be very clear whether you are going to develop the tool or whether you are going to select a standardized tool. Now, the third point, if you are selecting a standardized tool, okay, this is for your information. Okay, like it's nice to write if your standardized tool, okay, have you got this is your practical point. Okay, like you should try to get permission for the standardized tool. Now there are two types of standardized tool. Some tools are free to use. Okay, they are very free to use, they don't have any copyright. Usually they mention in the tool that it is free for academic purposes. Okay, so in that tool, like that okay, this is a free tool and you can use it. Whereas some tools, they are copyrighted, which means you should ask you should send a mail and you should get permission from the author. Sometimes it is a paid tool where you have to pay some money and then you will have to download and take the tool. So this may not be very, very important for a proposal, but for the final dissertation presentation, it's very important because you have to write all these points where inside the dissertation. You should write it is a standardized tool. If you have got permission, that annexure should be there in the dissertation. So please be careful. I have personally seen some students like they use standardized tool, but they don't get any permission to use the standardized tool. See, the problem is when you're going to publish this study, okay, if you have not got permission, okay, there can be there can be a lot of problems which can arise. Okay, so that is why please be clear whether if you are using a standardized tool. And it's nice to specify inside the proposal that it is a standardized tool, and you can even specify the reliability or the Cronbach's alpha value. Okay, because any standardized tool will be having that construct validity and they will be reporting about their reliability. Okay, I know this may be a little bit too high for a beginner level PG student, but it's very easy. Now if you're using a standardized tool, you do one thing, just type the name of the tool and then you just type in Google reliability and validity. So if it is really a standardized tool, you will have certain documents opening up, and once you read that, in the conclusion you see they would have written, okay, they would have written what is the construct validity, what is the Cronbach's alpha. That's it. So you're just making sure that this tool is reliable feasible and valid. Okay, so that all you need not write in the proposal, but at least you should be familiar that if you are saying that it is a standardized tool, please write there it is a standardized tool with a Cronbach's alpha value of this much, which automatically is self-explanatory that the tool is reliable. Okay, so these are the three things which you should write about tool. Okay, name the tool. Please tell us whether you're going to prepare the tool or whether you're going to select a standardized tool. If you're using a standardized tool, again, please do mention the validity and the reliability aspect of that particular tool. Now coming on to the technique. What do you mean by technique? Technique of data collection. What are the various techniques of data collection? Maybe I do it as a self-report method, maybe structured interview, unstructured interview. Yes, all those things, even biophysiological measurement. If you're going to check the blood pressure, say ABP, so many things. If you're going to check, what is that method you're using? Biophysiological measurement. Now coming on to my example, what I told you, the technique of data collection will be say it is a self-report technique. Self-report means they themselves, they will go through the rating scale and they'll put a tick mark or that thing and they will give back to me. Or even I can use a structured interview. Okay, structured interview means you ask for each and every participant the same questions and the investigator is going to fill up the column. So that's all about tools and techniques. So please mention the name, whether it is a standardized tool. If yes, tell us the reliability. If you're going to prepare the tool, tell that also. A tool will be prepared. Okay. And then type of technique, please write whether it is self-report, observation, biophysiological measurement, interview, etc. Next one is pilot study. What is a pilot study? Pilot study is a small study. It is a mini study which you do before the main data collection. So in pilot study, you may have to tell us what is a sample size. Okay, what is a sample size? Usually, in all standard textbooks, they say 10% of the main study participants will be the pilot study. Okay, so please do write a sentence like a pilot study will be done with so many participants in order to test the feasibility of using a particular intervention or maybe a particular tool. If you are preparing a tool, okay, if you are preparing a tool, you can write in order to check the feasibility of a particular tool, feasibility of a particular intervention, or the feasibility of the whole data which is going to be collected. Just one sentence will be sufficient in a research proposal. So you will have to write which patients, how many number you are planning, and what is the purpose of conducting a pilot study. That's it. Next is plan for data collection. This is something very important because you are informing the university how exactly you are going to do the data collection, how exactly you're going to collect the data, the flow of the study. Suppose if you're doing an interventional study, what you should write? You should write when the pre-test will be conducted, when the intervention will be given, when the post-test will be conducted, how many sessions of interventions you're planning to do, is it on day one, or how many times intervention is given, how many post-test you're going to collect, right? All those things should be specified clearly in the plan for data collection. And if it is going to be a higher level study, or say it is a large scale research study, then there will be many people. So who is going to give the intervention, who will be giving the testing of the tool, who will be giving the instrument, all such things. Okay, so your plan for data collection, anyway, you will be thorough how exactly you want to collect the data. So which day, what you're going to do. Okay, like if you're going to say that you're going to do an interview, at least you should have an estimated time for the interview. Okay, it may increase, it may decrease, that's a different story, but you should have a plan. Okay, at least for an approximate time. Suppose if you're going to do a planned teaching program or a structured teaching program, what is the duration of that structured teaching program? How are you going to deliver it? Okay, is it an individual or is it a group teaching what you're planning to give? So all such things, each one word only it will be there, but you should connect it. All those important words should be connected as sentences and you should write it under plan for data collection. Next is plan for data analysis. The most beautiful aspect of writing a research proposal is it makes you to think very broad. Okay, you are very very clear about what analysis you are going to use in your study variables. For each variables, how we are going to measure it. Okay, so by the time you complete your research proposal, you're thorough. Okay, you know that, okay, fine, these are the statistics which I am going to use in my study. So how do you get it? Consult with your statistician, with your guide, and come to an understanding for each variable how you are going to measure. Like in this study, maybe the demographic variables will be analyzed using frequency and percentage, because that is the only possible statistics which I can do there. Maybe to test the intervention on fatigue, maybe I can do, if it's a true experimental design, I may go for an independent t-test. If it is going to be a say one group pre-test post-test design, I may go for a one paired t-test. If it is more than 3 variables, I may think about ANOVA. If there is an association, maybe chi-square. And see, everything statisticians will be able to guide you very nicely, because they will make sure that your data is following a normal distribution. If your data is following a normal distribution, okay, then maybe you can use a parametric test depending on your sampling technique, depending on your sample size. They will give you guidance. So consult with your statistician, finalize with your statistician what is the statistical test you're going to do. Okay, so that is about the plan for data analysis. So how will you write that in a research proposal? The demographic variables will be analyzed using frequency and percentage. The effect of this multi-component intervention on fatigue will be analyzed using independent t-test. The association of the demographic variables with that particular variable of fatigue will be, okay, it will be analyzed using chi-square. Okay, so that is how you're going to write the plan for data analysis. Sometimes what students do is, because the word count is very less, they'll just write it will be analyzed using descriptive and inferential statistics. Descriptive statistics, bracket frequency, percentage, maybe mean, standard deviation. Inferential statistics, you write t-test or pair t-test or chi-square, finish it off. Okay, so that is how you can write plan for data analysis. Next is the work plan. Next, what the university wants to know is, how are you going to do your work plan? Okay, which means this will be an eye opener for you also as you are going to write the research proposal. Okay, what is a work plan? The major phases of the research project will be displayed, and the researcher is estimating when will be the starting period and when it will get completed, and that sequence and the timeline can be seen. Now, this is an example of a work plan. Okay, see, this is not the only way how a work plan can be written, and there are different ways of creating work plan. Okay, beautiful work plans, models are available in Google. Okay, you can just Google it up and you can see. See, you have in good dissertations proposals, you find that even in an Excel sheet. Okay, in an Excel sheet, you can give that timeline can be given, and then you put various colors to depict when will be the proposal presentation, when will be the data collection, when will be the pilot study. All those things can be displayed. This is just a tentative thing to show you like the various activities and the tentative time period. Maybe we start from May 2021 and then I finish my whole dissertation and submit to the university by say June 2022. What are the various things in which month, which year, everything is planned. So by the time you finish this, you are very clear. Okay, by next year, June, I should submit my dissertation to the university. Main study data collection is somewhere around January or February. So that is how the researcher gets oriented to the work plan. The university is also very clear that you have planned it correctly. Next is budget. Okay, budget is nothing but you are projecting all your activities into terms of money. Okay, like budgets are statements of how the money is going to be used or how much of money is required to complete a project. Why is the university concerned with the budget? Because I feel the main reason why we ask about budget is so that the students have an idea how much of expense is going to be there. And number two is it's just a postgraduate. If it is a postgraduate nursing research work, okay, I don't think there is a need to spend lots and lots of money for the sake of one research project. Okay, because your total weeks given for completing a dissertation is only 6 weeks total. Okay, so now you have limited period, and within this period, say for example, if a student is interested to test an intervention, and that particular intervention, getting certified for that particular intervention is say around 15,000. usually a guide or a teacher will say there is no need at present because it need not be an expensive. Postgraduate research is a learning time period. Okay, it is a period when you really learn what is a research methodology, and you are very thorough with all the steps of research process, so that you are really confident to take over a group of students in the future where you are going to be the guide. So that is the main purpose of having research. So budget is a estimate, like how you will get an idea like how much you will have to spend for the sake of a nursing research work. There is no minimum or maximum limit, but still a highly expensive research may not be needed, okay, because you are undergoing through a very brief period of dissertation or a data collection and analysis where you are expected to complete a requirement so that you will be knowledgeable about the research process. Next is you will have to write about the, so you may have to give a picture of your budget when you're writing a research proposal. Okay, maybe like this is not the ideal one. It's just an example to show you can develop your own budget. You can think over and see what may be the stationery charges, printing charges, transportation charges, all those things you can put in a table and you can submit. The next one is ethical consideration. It's very important that you should get an ethical clearance before you submit your proposal to the university. Usually we do add the IEC number, that is the Institutional Ethics Committee number is being added on to the place where we are going to write on ethical considerations. And please do add a note on what principles will be followed in your study. See, the common words what we use is like confidentiality, anonymity, informed consent will be taken. So all such words should be put because the student should be aware that ethics committee approval is something very important, and that you are telling that all these principles will be followed. So that is how you write the ethical consideration. Next is references. Very often what happens is usually a student designs a research proposal so beautifully till ethical considerations. But when it comes to references, you will find that the references are not written properly. Okay, so please take care to follow the referencing style given by your university. If you are under KUHS, Kerala University of Health Sciences, then the referencing style is Vancouver style. Okay, so please read on what is Vancouver style. A simple tip I'll tell you, Vancouver style means in text referencing. That is within the text, whenever you are referencing, you highlight it by superscript number. Okay, say 1, maybe 2, 3, 4, again a 1 come, again 2 may come. Okay, so you should know what is the order of writing a Vancouver referencing style in both in the in-text as well as at the end of the research proposal. And one more thing what I can suggest is like you can use softwares so that errors will not be there. I'm sure that all students who are listening to this particular session, you all will be aware about the various softwares which are available for referencing, for writing references. Okay, so one software I will tell you, the name is Zotero. Okay, Zotero. Zotero software can be used in order to generate references. It has its own limitations, but still comparatively it is a good software. Not only Vancouver, you can reference APA style, Campbell style, lot of styles are there. So for us, we just select Vancouver and you're going to change your references into Vancouver referencing style. So please give due importance because it's very, very important. Because in proposal, if you're not going to correct it, in dissertation also, it is going to be a big error. Okay, so you should really learn. See, one more way I'll tell you. If you're not very familiar with Zotero, you do one thing. You just go to Google, okay, and you just type it like create Vancouver referencing. I'll tell you the exact word, Vancouver reference generator, free Vancouver reference generator. Now you open that particular site, and then you will have to add the name, the volume, maybe the edition, the name of the author. So every spaces are there. Just manually enter it and just click create reference. Okay, so it will ask whether it is APA or Vancouver. You say Vancouver, and now it's perfectly correct. Okay, your reference is ready. You can copy it and put it into your Word document. So that is how error-free references can be generated, but the most best one is Zotero. Okay, so try to look into it, Zotero referencing, or go for a free Vancouver referencing generator. Time being for research proposal, you do that. For your dissertation, you think about going for Zotero referencing. The last part we have come, that is the annexures. Okay, annexures in Kerala University, you are expected to submit two annexures. One is you have to submit your informed consent form. Second thing is you are supposed to submit the instrument. They ask you to submit it in English language. Okay, just to make sure that you are aware about how to create a, whether the student knows how to prepare a consent form. Has she added the important points in the consent form? That is what the reviewers are going to do. Number two, in tool or instrument. Say suppose you doing a study on two variables, okay, two variables, say fatigue and quality of life. Now I have two tools. Should I upload the complete two instrument? I am preparing it. Okay, it's not a standardized tool. Let us say that I'm preparing it. Should I write all the items in the tool and should I upload it? See, as much as possible, try to send the complete tool. But if the KB size is very, high, and if it is saying that it cannot upload, at least try to write few items under each tool or under each scale. Okay, few items means, say for example, I have 30 items I have planned. At least 15 items, and how you are doing the scoring interpretation. At least that much you send it to the university. See, the purpose of looking into the tool during the time of review is not to see whether you are writing that correctly, stem correctly, not for that, but to get an overall idea whether whether this checklist is enough to measure that fatigue. Is checklist enough, or should it be a rating scale? So the evaluators will suggest you, like, this may not be enough. Why don't you think about changing your instrument into a rating scale? Okay, so the main purpose is to know whether this tool is really measuring that particular variables which is there under the research study. Content validity of the tool, all those things you will be doing it later. Okay, you will be doing it once you get approval from the university. Definitely you will be sending it to experts and you will be taking. So if possible, you send the full tool along with the scoring interpretation. But if it is really too difficult for you, at least few items, and then you can say 30 items are there, but you write only 15, and then you write how is the scoring interpretation, so that the evaluators can judge whether this particular instrument is sufficient to measure the concept of that particular variable. So that is what you do it in annexures. Please send the consent form and the instrument. So thank you all. And so before I wind up, okay, so we have seen in this session completely regarding how to write a research proposal from methodology, okay, till that annexures. Okay, so I hope I have made certain points clear, but again I would like to inform you all that this is only a basic skeleton plan what I have discussed. I have not gone into the details of each and everything. Okay, so definitely your guides and your teachers are the wonderful persons who can help you to write a research proposal in depth. Okay, so whatever I have said is not the final one, or it is not that complete ideal one. It is only a skeletal plan which will help a student. I suppose it may help a student to realize what are the important things I should write under each heading. So it is just a reminder. So please don't think this is a final ultimate thing. No. Okay, there are lots and lots into it, so which your teachers may be able to help you in a very good way to write and submit a research proposal. Okay, so I wholeheartedly wish that all of you who are watching this video, by the grace of God, you all will be able to submit a very good research proposal to your university, to your respective university. So even before I wind up, I would like to wholeheartedly inform all of you that my wholehearted thanks to Professor Dr. Geeta Kumari Madam. She is the principal of Government College of Nursing, Thrissur. Actually, it was Madam who told me, or who suggested, that you take this particular topic for students so that it may be useful to a lot of nursing students. So at this point, I would like to thank Geeta ma'am wholeheartedly for her very genuine suggestion, because only a good teacher will know what is the pulse of the students. So I thank her for that great suggestion, and I thank all of you, okay, whoever is watching this video, for your great support and encouragement. So thank you.